For legislative session day 20-032. Council, as you know, we're still meeting with a modified agenda due to the ongoing health emergency. At this time, I'd ask you to please join us in standing for the pledge, followed by the opening prayer by Councilman Wagner.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, liberty and justice for all.
Our dear Heavenly Father, we give thanks for this day and to live in the free country that we do. Each one of us knows that it is a privilege to serve the citizens of our great county. Guide over our thoughts and decisions. Bless those who are suffering this evening and give them healing and peace. God, we pray for our country that thy will be done. In your name we ask these things. Amen.
Amen. Thank you, Councilman Wagner. Agenda item number 4, special presentations. Council, this evening, we have Mr. Colin Ward with us from Upper Chesapeake, along with Miss Vicki Bands. And Colin, if I may, after last week with the questions that we had in reference to testing and some other pieces, I've asked you to come back and give some clarification and some updates. So whenever you're ready, sir. Are you there, Colin?
Sorry about that.
That's quite all right.
Thank you, Council President Vincente and members of the County Council. At University of Maryland Upper Chesapeake Health, we continue to experience volumes that are higher than the initial surge in the spring, but comparable to other hospitals across the state currently. The daily COVID census remains between the mid-40s and the mid-50s every day, combined in our 2 hospitals, and has since November. We are providing care in special COVID cohort units, and our emergency department team is even evaluating the possibility that some COVID patients may actually be appropriate for discharge directly from the emergency room to their home to continue to recover. Vicki Bands, our Director of Community Health Improvement, and I are here today to provide an update on COVID testing. 5 days after the initial case at Upper Chesapeake Medical Center in Bel Air on March 13th, we partnered with Harford County Health Department to begin collecting COVID samples in a location that would not potentially contaminate a doctor's office and would be safe for our community members. First in the Upper Chesapeake parking lot, then in the former Bel Air Auto Auction, followed by the Forest Hill Emissions Inspection Site, and now to the Aberdeen testing site as of October 1st. In this nearly 9 months, a group of a dozen or so dedicated team members, nurses, and support staff have collected more than 15,000 samples from our community, and this includes a single-day event at Ripken Stadium in August with more than 700 samples collected. This partnership has leveraged the use of a test with high reliability, known for the ability to accurately indicate a positive result when the patient is positive and a negative result when the patient is not. The samples are processed in a lab in Frederick, and results can be available in as little as 24 hours or as much as 5 days, depending on the changes in the community demand for testing. I'd like to invite Vicki Bands to present more information about our current testing operation in Aberdeen.
Good evening. Beginning October 1st, we started a testing program at the new Upper Chesapeake Aberdeen campus off of Route 22 next to the Target. This is the first, we were the first in the state to be able to provide testing in a safe indoor facility. And this facility has actually become the standard for testing for all of the testing sites for indoors. At the time that the program, we started the program up there, we had a 4-hour sessions, 4 days a week. And in concert with the move to the new location, we implemented 2 critical changes to the testing program. First, doctor's orders were no longer required to get a test. And secondly, patients could schedule themselves using a special website that was set up by our partners at the State Health Information Exchange with the website being called CRISP, or program being called CRISP. Upon moving from Forest Hill to Aberdeen, we've noticed a far more culturally diverse population seeking to be tested, both in terms of their age and ethnicity. We're also seeing entire families that are in need of testing, and perhaps more importantly, we are seeing even sicker patients, those with obvious symptoms of COVID, that these are all coming to the Aberdeen test site. In response to the recent surge in COVID cases, we have seen a correspondingly increase in the demand for a test. As a result, we've added another 4-hour session and increased our testing hours now to 20 hours per week. This includes evening hours that we have on Thursday evenings. The greatest number of tests conducted in a single day in our prior location was about 125. In this new Aberdeen location, we are routinely collecting between 150 and 200 samples each session, so putting our weekly totals at close to 1,000 specimens collected. Should the demand surge again, we believe that we have the ability to further ramp up our capacity there, and we will continue to work closely with the health department to determine any changes to hours of operation or the number of slots available each day. One concerning trend that has been an uptake in the number of patients that reserve a testing appointment but fail to show up. This could be as many as 30% of the daily schedule volume. As a result, we would strongly encourage those who have made an appointment to keep it, or just as importantly, cancel it so that another member of our community can get tested. We rarely turn anyone away, and when there are gaps with no-shows, we take people in as walk-ups and really don't turn anyone away. We appreciate the support of our team from across the community, and we really look forward to continuing to serve our friends and neighbors during the pandemic. We're happy to answer any questions that you might have tonight with regards to testing.
Thank you, Vicki. Council, it's your time for questions. Councilman Jan Giordano.
Good evening. Let me make sure I unmute that. Vicki, thanks for the update on the testing facility. Seems that a lot of people also are looking for the rapid test, which I know is not as effective, but a lot of people want to get that test, especially if they've, want to get back to work and they've been somewhere and somebody's requiring to do that. Well, is there any talk about you guys doing rapid test as well, or are you just going to do the test with is it the PCM, I guess?
The test is a PCR test that we perform. It's a much, like you said, it's a much respected, accurate test that we do. A lot of your places require a PCR. Kids returning to college, if you're traveling, those kinds of things, they are requiring a PCR test. So we will continue to use the PCR. At this point in time, we would not have the ability to do rapid testing. That's not to say that if that is something that we need to be able to do down the road, that we would certainly talk to the health department and look at to see what our options might be. But currently, the facility is not set to be able to do rapids at this point in time.
Okay, thank you very much.
Council, anyone else?
I got one.
Mr. Schroeds.
Thank you, Council President. I'm not sure if this is better to be answered by Colin or you, Vicki. Has there been an increase in mental health visits because of the isolation caused by COVID? Anywhere, that would include like at the crisis center or at any of your facilities. So we keep hearing about, and of course, we're experiencing this, many of us at home. Has it gotten, have you noticed it getting to that level where you've seen substantial increases with the mental health?
Yeah, so this is Colin, and I can speak to the Klein Family Hartford Crisis Center. We are seeing outpatient clinic visits that have increased beginning in the July timeframe. We're starting to see that number increase. slight upticks in the urgent care activity at the Klein Family Hartford Crisis Center. There was a significant increase beginning in the July timeframe in residential bed utilization there as well. So we do think there was a period of time in the springtime where people were isolating and not getting the care they need, but we have seen for the better part of 4 months or so an increase in the utilization of our behavioral health services.
Right. Do you have that data available? Is it like a percentage number, or do you have any idea what that would be pre-COVID versus what we're dealing with now? I know you deal with all types of issues at the crisis center that may be unrelated, but a lot of them, of course, there are other, alcohol abuse and drug abuse that goes along with mental health at the crisis center. Is there a way to correlate and break down what's related to COVID and what's not? And I guess the second part of that question would be, is how many visits were made by school-age children? Because, I have a young one at home, and she misses her friends and teachers so badly, and, we know it's affecting them. How many of your patients are school-aged?
Unfortunately, I don't have that information available with me tonight in terms of age breakdown, but I can tell you that our clinicians are working actively to try and engage with different populations, and they do talk about isolation being one of the key factors, and they have expressed concern for people, particularly over the holidays, that have been isolating. In terms of, activity, I don't have a percent increase, but I'll give you 2 points of reference. So our urgent care volume at the Klein Family Hartford Crisis Center back in April, at the height of the first wave, was slightly less than 100 urgent care visits in that month. And in our most recent month, we've almost done approaching 300. So we've seen that volume come back significantly.
All right. Now, are you in conversation with the schools, with their counselors and others that would deal with this, and you guys correspond to see how you can help each other out and to try to stay on top of this?
Yeah, so we actually have a partnership through Healthy Hartford. The school superintendent sits on the board of Healthy Hartford, and Barry Klein, the executive director, works closely with the school system. And as well, we work through the health department to try and coordinate efforts with the school system.
Okay. All righty. Thank you.
Thank you, Mr. Schroeder. Mr. Wagner.
Who pays for the tests at the different locations when a person shows up to get a test done?
At our Aberdeen location, the tests are being paid for by the state. There is a grant that was received early on for a year, and those tests are paid for by the state. At the urgent care facilities, insurance is being billed, but it is my understanding that a copay, or if someone does not have insurance, they will be waived.
So their own personal insurance is billed?
That their own personal insurance is billed, but if there is a copay, they are not required to pay that copay.
Okay. Is there a limit, or is this getting too far into it? If a person decides within a 2-week period that they need 4 or 5 tests for whatever reason, would the insurance company refuse to pay, and then you'd have to self-pay the total, you think?
I could not answer that question.
Okay.
I can
All
tell
right.
you that we've had plenty of people come to us 4 or 5 times, and they are not turned away.
Right. They're not turned away. I just was wondering what the billing situation was going to be in the end of the day, whether they had to take care of it themselves or if insurance just went ahead and did it anyway, or the state kicked in. But that's all right. If you can find that out, if you hear about it later, let me know if you don't mind.
Sure.
Thank you.
Thank you, Mr. Wagner. Anyone else, council? And then, Colin, if I may, either you or Vicky, in reference to the testing, the numbers that you're doing at Aberdeen account for, if I remember correctly, less than 40% of the tested in the county. Is that correct?
Yeah, I think the daily testing volume for Harford County residents fluctuates. So in the last 10 days, I've seen it as low as 790 and as high as in the 1300s. So that number is a bit of a moving target. But yes, under 40% with a capacity right now of 1,000 per week.
Okay. Thank you. If no one else has any questions, I appreciate your update, and I'm sure we'll be talking again soon. Thank you very much, both of you.
Thank you and happy holidays.
Thank you.
Same to you. Agenda item number 5, approval of minutes. Public hearing December 1st, 2020. Legislative day 20-031, December 1st, 2020. Are there any corrections to the minutes? There being no corrections, the minutes stand approved. Number 6, introduction and consideration of resolutions. Resolution 023-20, Enterprise Zone 2211 Lakeside Boulevard, Edgewood. May I have a motion?
Mr. President,
Mr. Johnson.
I'd like to make a motion to approve Resolution 023-20 Enterprise Zone 2211 Lakeside Boulevard, Edgewood, Maryland.
Second.
Thank you. Thank you, Mr. Woods, for a second. Moving and seconded to approve the resolution 023-20. Any discussion? Ms. Dixon.
Mr. President,
Aye.
Mr. Johnson,
Aye.
Mr. Woods,
Aye.
Mr. Giangiordano,
Aye.
Mr. Schroeds,
Aye.
Mr. Wagner,
Aye.
Mr. Beulah.
Aye.
7 votes in the affirmative, 0 in the negative. Resolution 023-20 is hereby approved. Resolution 024-20, Enterprise Zone 1225 Philadelphia Boulevard. May I have a motion?
Mr. President,
Mr. Beulah.
I make a motion to approve Resolution 024-20, Enterprise Zone 2115 Philadelphia Boulevard.
It's 1225.
1225.
It's
1225.
1225.
I'm sorry, 1225 Philadelphia Boulevard.
Second.
Thank you, Mr. Woods, for the second. Moved and seconded to approve Resolution 024-20. Is there any discussion? Ms. Dixon.
Mr. President,
Aye.
Mr. Johnson,
Aye.
Mr. Woods,
Aye.
Mr. Giangiordano,
Aye.
Mr. Schroeds,
Aye.
Mr. Wagner,
Aye.
Mr. Beulah.
Aye.
Being 7 votes in the affirmative, 0 in the negative, Resolution 024-20 is hereby approved. Resolution 025-20, Enterprise Zone 3 South Rogers Street. May I have a motion?
I move to approve resolution number 25-20, Enterprise Zone known as 3 South Rogers Street, Aberdeen, Maryland.
Second.
Thank you, Mr. Wagner. Mr. Woods. Moved and seconded to approve Resolution 025-20. Ms. Dixon.
Mr. President,
Aye.
Mr. Johnson,
Aye.
Mr. Woods,
Aye.
Mr. Giangiordano,
Aye.
Mr. Schroeds,
Aye.
Mr. Wagner,
Aye.
Mr. Beulah.
Aye.
Being 7 votes in the affirmative, 0 in the negative, Resolution 025-20 is hereby approved. Resolution 026-20, Enterprise Zone 900 Beards Hill Road. May I have a motion?
I move for the approval of resolution number 02620, known as 900 Beards Hill Road, Aberdeen, Maryland.
Second.
Thank you, Mr. Wagner. Mr. Woods. It's moved and second to approve Resolution 026-20. Is there any discussion? Ms. Dixon?
Mr. President,
Aye.
Mr. Johnson,
Aye.
Mr. Woods,
Aye.
Mr. Giangiordano,
Aye.
Mr. Schroeds,
Aye.
Mr. Wagner,
Aye.
Mr. Viola.
Aye.
There being 7 votes in the affirmative, 0 in the negative, Resolution 026-20 is hereby approved. Mr. Woods, please read in Resolution 029-20 into the record for introduction.
Thank you, Mr. President. Resolution 029-20, Notice of Sale CPI Consolidation Resolution 2021, introduced by Council President Vincenti at the request of the County Executive. A resolution to authorize the issuance, sale, and delivery by Harford County, Maryland, the county, of its bonds designated Harford County, Maryland Consolidated Bond, Public Improvement Bonds, Series 2021, the CPI bonds, in the original aggregate principal amount not to exceed $55 million, pursuant to the provisions of Section 19-101 of the Local Government Article of the Annotated Code of Maryland, 2013 Replacement Volume, and 2019 Supplement. The Consolidated Bonds Act, Section 524 of the Charter of Harford County, the Charter, and Sections 123-40 and 256-26 of the Code of Harford County, the County Code, confirming that the principal, premium, if any, and interest thereon shall be general obligations of the county, secured by its full faith and credit and unlimited taxing power, determining that the CPI bonds shall be sold by competitive bid, appointing a bond register and paying agent for the CPI bonds, approving the substantially final forms of various documents to be executed on behalf of the county in connection with the issuance, sale, and delivery of the CPI bonds, determining the date of sale, determining the average probable useful life of the improvements or undertakings, with respect to which indebtedness evidenced by the CPI bonds is to be incurred, determining various other matters in connection with the issuance, sale, delivery of the CPI bonds, included but not limited to provisions in the notice of sale for changes in the aggregate principal amount of CPI bonds to be sold and changes in the principal amount to mature in certain years, and determining that the CPI bond shall be consolidated for the purpose of sale. Resolution 029-20 does not require a public hearing and will be considered at the next council meeting.
Thank you. I believe at this time we have Mr. Salas, our county treasurer, and Mr. Fabian Walters, special bond counsel, to provide a presentation.
Yes, good evening, Council President, members of the council. So I will just go forward with just a little bit of the process and talk a little bit about some of the projects that we are going out to the bond sale for, and then I'll let our bond counsel fill in any of the gaps on the legal framework of this sale. So we are coming forth with requests for the terms of sale resolution for a bond sale in the amount of $55 million to be held on February 2nd of 2021 for the various projects that are listed here within the resolution, which we'll talk about in a second. I should note that all of these projects have been through the county's budget process. They've been approved by the county council. These would be any of the projects in the capital budget that had bonds listed as a revenue source. And then following the adoption of the budget, we always have the bond authorization bill, which lists all of those same projects that have bonds as a funding source. As projects take various times to get moving and the like, there is a little bit of a lag between the actual bond sales and the bonds that are approved in the budget process. And that's now the point that we are at now, having about $55 million of expenditures from various capital projects that the county needs to reimburse itself for. As far as those projects go, about more than half, about 30 million, are for school projects, with the bulk of that being from the Havre de Grace High School, middle and high school replacement in the amount of $25 million. Other than that, there's about $9 million in various county facility projects, about $6 million in the stormwater projects that you just heard about from Christine Buckley, about $5 million in road and bridges projects, and about $2 million in park projects. And then finally, about $3 million in water and sewer projects. And those water and sewer projects, unlike the other projects, those are funded by the user fees that the water and sewer users pay. So if you're not on the county's water and sewer plan, your taxes to the county do not pay for those projects. Only people who belong to the water and sewer system. And again, so the plan is to go to sale on February 2nd. Sometime later next month, the county will be going after its credit rating from 3 credit rating agencies. This year, of course, it'll be a virtual or Zoom rating presentation, and then we will shortly thereafter have those ratings and in enough time to go to competitive sale on the 2nd. With that, if there's any comments by our bond counsel.
Mr. Walter?
I'll just add that, again, this resolution approves the $55 million worth of general obligation bonds. The county's full faith and credit and taxing power are pledged to the repayment of these bonds, and that most of these projects have been approved by previous bond bills and the bond bill that we passed this past summer. And that's all I have to add.
Thank you, Mr. Walters. Council, at this time, any questions? Seeing none, Mr. Sandless, Mr. Walters, want to thank you for your presentation. And as stated earlier, the resolution does not require a public hearing, so it will be considered at our next council meeting. Thank you.
Thank you.
Agenda item number 7, business from the president. I just want to give a quick reminder, we will have our adequate public facilities meeting virtually Wednesday, December 16th at 6 p.m. Information on how to listen into the meeting is available on the county website. Also, quickly, I want to give a special shout out to Bobby Gall Sr. and his family on their 90th anniversary at Gall's Bakery in Havre de Grace, and I'm sure my colleagues will have much more to say. And with that, Mr. Johnson.
Thank you, Council President. I don't have anything tonight. Thank you.
Thank you, Mr. Johnson. Mr. Woods.
Thank you, Mr. President. I'll pass as well.
Thank you, Mr. Woods. Mr. Giangiordano.
Thank you, Council President. I also would like to give my congratulations to Gold's family, Gold's Bakery, and Bobby Gold Sr. It was an honor to be there. I've known Mr. Gold for a while, and also his son Bobby. So it was good to be there. I just want to remind everybody that second round of funding for people that applied and were approved went out this week. The restaurant program funding is still going to be distributed. It has not yet at this point. So I've checked on that. But I also want to implore the citizens of Hartford County to visit the restaurants. They are the hardest hit in this pandemic of pretty much of anything. I know the schools, but the restaurants, a lot of the restaurants are individually owned. People put their life, sweat, and tears into them. Now that indoor dining is not going to be an option because of the weather, please order takeout. It's very important. Hopefully there will be no more lockdowns. I think they've proven that you can eat in a restaurant safely and not spread any germs. So it's extremely important for that you get out there, you support those businesses as best possible. We don't want to see restaurants closing up, which has happened. So I do implore everybody, if you used to go out a couple times a week, please order from your favorite restaurant as much as possible. They can certainly use your business. And that's all I have, Mr. President. Thank you very much.
Thank you, Mr. Giangiordano, for those comments. Mr. Schroeds.
Thank you, Council President. Unfortunately, I missed the Gall's Bakery 90th anniversary somehow. I apologize. I will have to make my way down there. That rarely happens, especially at a bakery. I do want to congratulate Amy Bogner from the Highland Association, Mason-Dixon Country, who hosted the Highland Holiday Tractor Parade. It was a huge success over the weekend, and hopefully that can be an annual event. And once we're through COVID, it can be a much larger event. And it's just a great thing for the community. Just want you to continue prayers for Sam Fielder, who is now home recovering, and also wish his wife the very best. I did have an opportunity to speak with both Doris and Sam this evening, and he's doing incredibly well. So hopefully he has a full recovery. It seems like he's meeting with all the right people, and that hopefully he can get back on his feet real soon. Also, we did celebrate Maddie's 11th birthday. It's hard to believe. I know that many of you remember when she was born. It happened to be she was born December 4th, which is normally every 4 years our inauguration. So she was actually born in sync with inauguration. So it's hard to believe she's 11 years old, and just incredibly proud of her. That's all I have tonight. I do have to take a quick important phone call, so I'm going to step out, but I'll be right back. Thank you.
Thank you. Thank you. Give Maddie our best. Yes. Mr. Wagner.
Since we last met, Council President Vincenti and I enjoyed a breakfast with some of the Maryland State Police retirees and their spouses. It was good to see many of those that we don't get to see that often, and see those that have served us very well in Harford County years ago. We get, and we struggle with the closures of the schools as well, and understand and hear so much from parents and other people about the trials and the problems they have with having to deal with everybody dealing with in-home school right now for the children. It doesn't stop with just the parents, children, and those that are concerned. I just wanted to bring the attention to the cafeteria workers and those that do stand out there in the inclement weather and whatever cold or whatever may bring, serving the many meals that they do serve to the children that stop in to get the meals. The numbers are staggering. 50, 60,000 meals distributed. That's huge. But we did want to just recognize the fact that just because schools are closed right now, that the people that work within the school system don't stop working, and we are not that we're the Board of Ed and can do much about it, but we do try to give them the support they need to keep moving ahead, because we don't know how long this is going to last, and we're all in this together. And with that, I've got it done this morning. Thank you.
Thank you, Mr. Wagner, for your comments. Mr. Beulah.
Thank you, Council President. Like Council President stated, had the honor this past Thursday of meeting Mr. Bob Galls and members of his family at Galls Bakery. Was just their 90th anniversary. Gave them a proclamation and purchased a lot of good treats. It was really a good visit. Too bad you couldn't be there, Chad. You would have liked it. Also, on another note, last week, or at the last council meeting, there was some information given out about Citizens Care as far as the number of deaths that had occurred as a result of COVID-19. I checked with Pete Panos, the Director of Administration, because I get daily briefings from him. I'm on the board at Citizens Care. And to date, there has been 0 deaths related to COVID at Citizens Care. And that's all I have, Mr. President. Thank you.
Thank you, Mr. Beulah. Agenda item number 9, comments and input from attending citizens. Ms. Dixon, do we have anyone signed up?
Yes, Mr. President, we have 7 this evening, or I'm sorry, 6 this evening. Our first 2 speakers, Jill Ferreira, followed by David Ferreira.
Hello?
Good evening, ma'am. It's Council President Vincenti. May I have your name and address for the record, please?
Yes, Jill Ferrara, 2000 Garden Drive. Tonight I will be speaking on excess deaths. We keep hearing differing statistics on whether there are or are not any excess deaths regarding COVID. Well, I've been following the numbers for some time, and I can assure you that there are most certainly deaths in excess compared to the same time period in 2019. The CDC has reported that there was a total of 321,000 deaths in the month of April in 2020. I also must note that was when everyone was masked and locked down in their homes. Compare that to 235,000 total deaths in the same month, 2019. That's an increase of 81 months. You jump to the conclusion that those deaths virus, I need now 60,000 were reported as quote unquote COVID related deaths and 26,000 with no COVID diagnosis. But there are a few things you need to remember about those numbers involving the reported COVID deaths. One, testing was very limited and patients only had to be suspected. Again, suspected, not confirmed to have COVID. Meaning if someone came in with a heart attack, hospitals didn't have to confirm you had COVID for them to classify it a COVID death. Two, the financial incentive hospitals were given to anything as death without any confirmation of illness. It always seems to be about the money. Three, flu, accidents, suicides, overdoses, along with the top 10 leading causes of death in the U.S. are being marked as COVID. Four, in August, the CDC specifically stated that only 6% of deaths were from COVID and the rest had 2 or more contributing causes of death, which means that out of that 60,000 COVID deaths, only 3,600 people in April died specifically of COVID, leaving 82,400 deaths that could have been prevented. If these had gotten early prevention for their medical conditions they needed instead of waiting too long to seek medical help because of the extreme fear-based propaganda our government and media has and is still pushing. There are as many excess deaths without COVID as there was with quote-unquote COVID, meaning that people have died needlessly. You all have pushed so much fear that you are causing more harm than the virus itself. That in turn means all government officials, including you, have blood on your hands. It is time for Harford County to take the lead and put an end to these mandates and lockdowns for the good of its people. Thank you.
Thank you, ma'am.
Hello, it's David.
Good evening, sir. It's Council President Vincenti. May I have your name and address for the record, please?
Yes, sir. David, 2000 Garden Drive. And Mr. Forrest, I do want to apologize. I did not the question. I just want to kind of comment on that real quick.
I actually appreciate it. I also have the with back to the video to you.
So now start of common sense. If you knew that the vast majority of the total deaths from COVID were from people with a high risk of death.
Mr. Are you there?
Yeah. Yes, sorry. Okay. I'm sorry. I don't know what's my way was on there. All right, so she's saying she couldn't hear me, but anyway, so the vast majority of the total deaths from COVID were from people with a high risk of death already without COVID and were in a nursing home. Would you still be so afraid? If you knew that after the lockdown and mask mandates, more people contracted the China virus who stayed home and almost always wore masks would be so. That there were treating patients with a with a success rate would still be so. If you knew. 100% true and factual. Ask yourself if every day I walk out of my bedroom on my way to the bathroom and sometimes stub my toe on something, but someone tells me you must wear blinders and that will stop it. They also say you do not have a choice, you must wear those blinders or face a fine or imprisonment. So you know it will not help, but they keep insisting. They tell everyone to do the same. Then there are reports of more people stubbing their toes with the blinders on. You then find out people who were stubbing their toes were either blind, partially blind, or blinded by the blinder. Would you still believe that the people telling you that to stop stubbing your toe in the morning was only remedied by wearing blinders? It would come down to common sense. If these acts worked, it wouldn't have lasted this long, nor would it be increasing. So I will ask one more question. Shouldn't the people in the states and countries without restrictions be all dead by now? Be a shepherd and not a part of the sheep. I thank you. Good night, Joe.
Thank you, sir.
Our next two speakers are Giovanni Ferreira and Kylie Snyder.
Hello, Giovanni. Apparently, nobody is hearing anything from the council meeting for public comment. Everything is glitching out. We can't hear anything.
Okay.
Nobody is hearing anything from the council meeting for public comment. Everything is glitching. I'm right here. I don't know.
Miss Ferrer, let me go to another caller and I'll come back to Giovanni.
Okay, thank you.
Okay. Ms. Dixon?
Mr. President, I will say we are aware of the technical issues we're having. We're working behind the scenes off and on to try to correct them. Our next
Okay.
speaker is Kylie Snyder.
Hello,
Good evening, ma'am. May I have your name and address for the record, please?
Kylie Snyder, 301 Victory Gallup Court, Happy Degrees.
Thank you. You can go ahead and continue.
I go to Happy High School and I'm in 11th.
Ms. Dixon?
Did we lose her?
I believe she hung up.
Okay. Our next speaker is Kim Novak, followed by Stephanie Flash.
Hello,
Good evening, ma'am. May I have your name and address for the record, please?
my name is Kim Novak. The address is 415 St. Clair Bridge Road in Jarrettsville.
Thank you.
Good evening, County Council. I appreciate your efforts on COVID thus far, but I want to give an account of what citizens are seeing in this county. Last night, HCPS held their meeting. Assistant Superintendent of Operations Cornell Brown stated enrollment numbers as of September 30th have seen a decrease of 1,083 students that have unenrolled from the system. 947 of those were elementary school students, and that was a decrease in the number of pre-K and kindergarten enrollment of about 900 students, fewer than what was based on the prior year numbers. Their enrollment 3,951 students in 2019 is 37,362. A further decline in enrollment since the numbers were reported in September. Ms. Karawacki also commented on the numbers, stating that she represents residents of the Route 40 corridor, of which she said parents in her community are voicing their concerns. She represents many lower income families who depend on the services of HCPS and want to know if the school system will be able to continue to support them, as the decrease in enrollment will affect the future year's budget. With the closing of schools, most students in Title I areas need more help, and the educational disparity only widens. I also saw a report from the Baltimore Sun regarding County Executive Glassman using $300,000 of CARES Act funding that the county received to put commercials on HCN, reminding residents to help stop the spread by continuing the practices of wearing masks and social distancing, which have thus far proved ineffective. Some citizens believe the money would have been better spent on helping these students rather than pushing a politician's career with free advertising, who is sharing no new advice for combating COVID other than he does not follow his own advice. As you can look and go back up, you will find the remaining photos and awards in our community, not doors and less than 6 feet apart from the recipient. The health department has yet to really publicly talk about how to combat and prevent the results on the mental health of our citizens. As we heard tonight, and I thank you, Mr. Rhodes, questions about the number of people who are seeking help at the crisis center. As they confirm, the number of people requesting help is up, but also there's a large number of people who are probably not aware of the center or who are afraid or unable to seek help. As we head into the darkest time of the year, even back in the pre-COVID times, the winter after holidays, suicides typically rise dramatically. There are also many children suffering from the effects of isolation, from not seeing friends at school. Marriages are having conflict, and people are told to stay away from their loved ones in order to stop the spread. When in fact, the latest numbers show that the death rate, if you contract the virus, is still relatively low. And according to a study by Dr. Christopher Pirelli at the NYU, it has actually decreased in the last few months to less than 1%. I'm asking council to dig deeper into the questions for the health department and their plan, and for continuing to work on libraries, public schools, and to come up with an operating plan now. No more restrictions. If you need help to develop a countywide operating plan, just ask the one place that has never closed for an employee who is tested positive, Home Depot. They seem to have it all figured out. Thank you.
Thank you, ma'am. Yeah. Let's go to Stephanie.
Hello?
Good evening, ma'am. It's Council President Vincenti. May I have your name and address for the record, please?
Yes, Stephanie Flash, President of Friends of Harvard. As we
I
move
need your address, Stephanie.
P.O. Box 294, Abingdon, Maryland 21009.
Thank you.
As we move into 2021, Friends of Harvard asked that the County Council creates legislation based on citizen concerns for land use development. Over the years, Harford County citizens have seen significant changes in the areas they live, changes that are guided by the Harford County zoning code. And in our opinion, many legislative sessions have introduced and adopted several changes that support development, but have not protected or even considered citizens' concerns. The enterprise zone expansion introduced to promote development and occupancy of vacant and underutilized land and buildings provides several opportunities for businesses, but where is the protection for the forested areas being cleared to include specimen trees at the Abingdon Business Park? Where is there any requirement to redevelop and restore? Where is the legislation for lighting to protect intrusive lighting into people's homes for all of the growth in the county? Simple legislative initiatives must be written by the county council and have been requested by numerous citizens. The recently expanded development envelope, to which the purpose was to protect sprawl, provides opportunities for residential and businesses. So we ask to please review the ways to balance lighting and to protect the open space, wetlands, forested areas during these changes. Another area to review is change uses in village business zoning. Over 1,000 people just recently signed a petition to express opposition of a chain shopping merchandise store in the Upper Crossroads area. Plus, over 100 people attended the community input meeting to express the same opposition as well. We believe the permitted use in village areas is long overdue for change. Based on Hartford Next master land use plan in the community planning areas, citizens' concern, and the definition of village business, which states the village business is intended to provide businesses while preserving and enhancing rural areas. Emotions flare when citizens reach out to elected officials and the response is, I, your elected councilperson, is opposed to this too, but there is nothing I can do. That's not good enough anymore. That's coming from the citizens. Friends of Hartford respectfully request all council members review legislation that has the potential to impact your districts and communities negatively. Don't wait for an issue which you can't help. The county council has the responsibility to introduce legislation that supports citizens' concerns. Friends of Hartford look forward to 2021 and are hopeful for legislation addressing lighting, vestmentry, waterways and wetlands protection, and a review of permitted uses in the county to include village business, among others that would reflect Hartford County citizens' voices. Thank you for your consideration.
Thank you, ma'am. We're going to go back to Giovanni Ferreira. Giovanni, can you hear us okay?
Yes, I can.
All right, go right ahead, sir.
My name is Giovanni Ferrara of 2000 Garden Drive.
Thank you.
With all the technical glitches that are going on right now, honestly, I don't think I should do my speech. I should only do a part of my speech. And the part of my speech is that the glitches that we are experiencing now and all the cutoffs with people speaking is what students are going through every day in school, including me. I am going through that every single day, trying to learn, and I can't really learn with audio being cut off. And I will give the rest of my time to my mother.
All right.
Based on all the glitches that happened tonight, it is evidently clear that this virtual platform for these council meetings are not working. There were glitches last week, there are glitches this week. I don't see any reason why council members cannot be in chambers in order to speak. I have no problem calling over the phone, but I don't feel that this platform is working at all. Half of our speeches are completely gone. You can't hear them. And that is all I have to say.
Thank you, Ms. Ferrer.
Mm.
Call Kyle Snyder now.
Hello?
Kyle, President Vincenti, can you hear me now?
Yes.
You want to try again, please?
Yes. Hello, I go to Happy Grace High School and I am in 11th grade. I am one of the many struggling students, not just in our county, but in the whole state. It has been hard going from a straight A student, excited to wake up for school every day, to failing almost every class and barely being able to get up out of bed. And I know I'm not the only one like this. That is why I am here, to be the voice for all the students my age that can't seem to find the motivation they once had. Why should we get punishment? How are we supposed to get our work done if there is no teacher encouraging us? Ever since virtual learning, us students have not been able to get the help from teachers we need, causing us to give up and to be left feeling stupid and not smart enough. It is frustrating when I put hours upon hours into assignments just to be given a 0 due to a technical difficulty that a teacher expects me to know how to fix. I wanted to call Maryland my forever home, but now I wish I never moved from New Jersey, seeing that all my friends there are in school and playing sports. Why is that when the number of COVID cases are higher in New Jersey than Maryland? School is a safe spot and home. Between abusive families and the number of students committing suicide, I think this is very clear. How would you feel being in a room all day, staring at a computer screen, with no interaction with people your own age? No one is listening to professionals to help us get back to a normal life. I have one last question to conclude this speech. Why is it that casinos are allowed to stay open 24 hours a day when I can't even attend school for 7 hours a day? Thank you.
Thank you. Ms. Dixon, do we have any?
There is no one else signed up to speak this evening, Mr. President.
Okay, with no one else signed up, this will conclude this meeting. Meeting adjourned.